Hi guys, my name is Micah, and today I'll be talking about bulimia nervosa, which is an eating disorder for our Module 13 video synopsis. Bulimia nervosa is an eating disorder marked by binge eating and followed by methods to avoid gaining weight, such as making yourself vomit, which is the main one. The causes of bulimia nervosa can be genetic, environmental, psychological, and cultural, although the main one is psychological. It can also be caused by stress, history of abuse or trauma, negative body image, and poor self esteem, and which a lot of people have this eating disorder due to they want to lose a lot of weight. They don't like their body image. They think they're like too obese or overweight. The symptoms of this eating disorder are weight fluctuations, electrolyte imbalances, broken blood vessels in the eyes, which make your eyes swell up, enlarged glands in the neck, oral trauma from always throwing up, making yourself throw up, severe dehydration, inflammation of the esophagus, peptic ulcers, as well as infertility. Which is a big one and can cause a lot of serious problems if you're trying to get pregnant. So especially for pregnant women who have this eating disorder, it can be very bad for the baby as well as the mother. Treatment for this disorder, there's really no like medical treatments that can get rid of bulimia nervosa. It's just very psychological. There's not really a medicine out there that is given to somebody that has this eating disorder to get rid of it or stop it from happening. So therapy is very important when it comes to this eating disorder. Somebody who has this eating disorder needs to get help, needs to improve their self-worth, needs to just become overall more confident with themselves and their body and in their body image, and not look down on themselves all the time, think they're overweight or think they're obese. Yeah, they just need to get help, go to a therapist that's really knows a lot about this disorder and can help them through many ways to help them become more self-confident about themselves and their self-image. Other treatments are discontinuing the purge cycle, improve negative thoughts, which the therapy will help them with, and resolve emotional issues, such as like having a lot of stress, which can lead to it, or just being like emotionally down all the time. There are also very bad and long-term consequences that if this eating disorder continues. One of them is severe hydration, another sore throat, tooth decay from all of the bad stomach acid that comes up through when you make yourself throw up, ulcers, irregular periods for females, constipation, bloating from all the food that you're taking in at one time and then throwing it all up, kidney problems, irregular heartbeat, weakened heart muscle, heart failure, low blood pressure, chronic fatigue. As you can see, all of these long-term consequences are very bad, and which a lot of people with this eating disorder deal with on a daily basis. I know there are a lot of people, a lot of young people, especially like college kids who have eating disorders. They go to college, they gain a little bit of weight as soon as they get there, and they deal with this thinking that they're overweight or they need to lose a lot of weight. This eating disorder can also be followed up by too much exercise, running a lot after binge eating and throwing up. So I would it's important for people who deal with this eating disorder just to get help, make sure they're going to treatment. And it's important for people who have friends that are dealing with this to make sure that they get them help, because this is very life-threatening disease, because you lose so much weight and you're eating so much food at one time and then throwing it all up, that it's just very unhealthy and very unsafe for the for the people dealing with this eating disorder. Thanks for watching my video.